I take great pride in the reputation that I've earned over the years in the community and like to believe that my patients trust me, and this is evidenced by the fact that we have returned patients and their children come back as patients. And this is my greatest source of pride, is when people come back to me again and again and again and bring their family members as well. The field of total joint replacements has changed dramatically. I can remember as a resident where the average length of stay for a hip or knee replacement was 2 weeks. Now, many of our patients go home in 1 or 2 days for full hip and knee replacements. We use a range of techniques and multiple types of pain medication to ensure that they're comfortable, and all of our patients walk the same day as surgery, and many go home in a day or two, which would have seemed remarkable only a few years earlier. I'm a board-certified orthopedic surgeon and specialize in sports medicine, and I perform 300 to 400 shoulder and knee arthroscopies each year. And I also specialize in total joint replacement and perform approximately 200 hip and knee replacements each year. I keep up on the latest techniques and believe I specialize in minimally invasive procedures, specialize in returning people to walking, functioning, and back to athletics as quickly as possible. For all of our patients, we always attempt a non-operative or a conservative technique when possible. No, I've yet to meet my first patient that wants surgery. No one does. It's scary, it causes apprehension, you lose time from work, and who wants to be in the operating room? No one. But sometimes it's necessary, and when it's necessary, we always assure that every non-operative technique has been tried first. In performing arthroscopic procedures, this technique allows us to assess hip, knees, shoulders, and ankles through small incisions that result in less pain and a quicker recovery. For our knee replacement patients, we offer both full and partial knee replacements, and the decision is made jointly between the physician and the patient as to what is the best technique possible for that patient. For full knee replacements, many patients go home in only a day or two. We use a minimal incision technique, which results in less scarring, a smaller incision, and of course that correlates with less pain. The partial knee replacements are all performed as an outpatient. They're done using a robotic and computer-assisted device to assure precise placement of the components, which of course results in quick recovery, a longer lasting component, and a more assured return to full function. Particularly now that I perform anterior approach hip replacements, I see my patients walking without a limp in a matter of a few weeks and back to the athletic field and performing full activities in a remarkably short period of time. Anterior approach hips allow less muscle dissection, less bleeding, and less pain. I enjoy embracing new technologies, but we do it with caution and care. I often tell my patients that I'm a first-last orthopedic surgeon. That is, I'm never going to be the first to jump on the bandwagon because too many things come along that are a flash in the pan. We want to use things that are established, and on the other hand, you don't want to lag behind. So I'll never be the last to adopt it, but I want to assure that when we employ new technologies, that they are tried and tested and assured to help our patients in the long term, not just something that will grab headlines in the short term, but may not stand the test of time. I became a physician because I wanted to follow in the footsteps of my grandfather. He was a family doctor in a small town in Ohio. And I loved the fact that he served the whole community. Everyone knew him and he knew everyone. His passion and care for his patients, I believe, has been handed on to me. And he loved his job, and I feel the same way. And he loved his patients and took great joy in seeing them recover, and the hands-on and touching and care that he rendered to his patients is something that I think of each day in an attempt to care for my patients.